Here is your question. Right. So if you have read and understood, considering its surgical pathology station, kindly please tell me what do you understand by the term peptic ulcer disease?
Yes, ma'am. Peptic ulcer disease is the break in the continuity of the mucosa, secondary to the any insult in the gastric mucosa, or that could be like secondary to the H. pylori infections or smoking.
All right. So what are the risk factors that lead to causation of this condition?
Uh, H. pylori infections, chronic smoking,
Yes.
and chronic NSAIDs abuse or chronic NSAID use.
Yes. Even steroids, etc. All right. Can you please tell me what is exactly the pathogenesis behind this condition?
Yes, ma'am. Due to colonization of the H. pylori infections, it produces certain kinds of toxins that lead to gastromucosal injury, and there is an imbalance between the mucosal defense and the damaging forces.
Right. Can you tell me how would you confirm your diagnosis? One that they have already done, they've done the biopsy. Is there any other test that you can do and you can confirm the condition?
Yes, we can do the stool antigen test.
Yes.
We can do the Campylobacter-like organism test and urea breath test.
What medication can be given to eradicate H. pylori infection?
We can give a triple regimen that includes the BID dose of proton pump inhibitors, that is 40 mg, metronidazole of 400 mg, and clarithromycin 250 mg.
Why do you think that this patient has undergone hematemesis?
Secondary to the peptic ulcer disease, that could be the ulcer that is eroding any blood vessels,
Or
or secondary to the hypercalcemia.
yes,
Hypercalcemia causes increased gastrin release, and increased gastrin will lead to increased production of the HCl.
okay. What else could be the cause of hypercalcemia?
Uh,
Yes, cause of yes,
yes, hypercalcemia could be secondary to the parathyroid adenoma or
yes,
hyperparathyroidism,
yes,
or secondary to the renal failure,
yes.
or the third cause could be any malignancy.
All right. Okay, you said because of hyperthyroidism. Right. How would you locate or localize the parathyroid gland?
In the perioperatively, we can do ultrasound map to the parathyroid adenoma. We
Yes,
can do system maybe scan,
yes.
and in the intraoperative period, we can do frozen sections to locate the parathyroid gland.
All right. What is frozen section? Please.
Frozen section is the histopathological test to microscopic analysis of the specimen quickly.
Right. What is the most common condition of parathyroid gland that leads to malignancy?
That would be solitary parathyroid adenoma.
All right. Can you tell me what type of tumor is parathyroid adenoma?
Uh, these are the benign tumors, and but are the functional tumors that leads to continuous secretion of the parathyroid hormone that is leading to the hypercalcemia.
How should this condition be managed?
The treatment of choice would be surgical excision.
Yes.
And for the management of hypercalcemia, there would be Aggressive IV hydration, forced diuresis, IV bisphosphonates can be given, and IV calcitonin can be.
All right. Biopsy report here was taken. Okay. Right. And yes, right. What do you expect to see in the biopsy report in order to conclude that it is peptic ulcer disease with hypercalcemia?
Uh,
Like
there
if
will
you can
be
discuss the histology of parathyroid adenoma.
Yes, there will be polygonal chief cells with small central nuclei and that are surrounded with the nest of oxyphil cells that are the clear cells. And some rim of non-neoplastic normal parathyroid glands are present at the edge of the specimen, which is surrounded by the fibrous capsule.
Okay. What are oxyphil cells or the oxyphil
Oxyphils,
adenomas? Yes.
yes, oxyphil cells are the clear cells or water-rich fluid. Sometimes if the whole adenoma is formed by ossifical cell, they will as ossifical cell adenoma.
If you fail to find parathyroid glands at their normal place, where would you find them?
We will find them in the superior mediastinum because uh, near the thymus because the thymus is formed by the third branchial arches,
Yes.
and that pulls the parathyroid gland to the superior mediastinum.
Can you tell me how would you classify hyperparathyroidism?
Yes, they are classified as primary, secondary, and tertiary hyperparathyroidism. Should I explain it now further?
Yes, please. Yes, please.
Yes, in the primary hyperthyroidism, the main cause is the solitary parathyroid adenoma, the most common cause. In the secondary hyperparathyroidism, the cause will be the renal failure. And the tertiary hyperparathyroidism, when the renal failure is corrected and there is ongoing parathyroid hyperplasia, that will lead to tertiary hyperparathyroidism.
If the cause of hyperparathyroidism is unknown in a patient and it's for you, it's idiopathic cause of hypercalcemia, how would you manage the patient?
Uh, yes, for the hypercalcemia, it will be managed according to the care of critically ill surgical patient protocol, and that includes the IV hydration, aggressive diuresis,
Yes.
IV bisphosphonates, and uh, calcitonin injections.
Okay. Right. Exactly. Okay. This investigation, gastroduodenal endoscopy was carried out. How exactly should it be carried out according to the NICE guidelines?
Uh, so the patient should be NPO for the 12 hours, and he should be empty stomach.
Yes, and
Uh,
continue, please.
can we see this question?
Okay, right. We want to come back to this one later. Right. Basically, all right. If a patient presents with the urinary tract infections, what might be the cause?
As the patient has a hypercalcemia, he could have renal stones that is causing the UTI, urinary tract
Okay,
infections.
good. Bell has gone. Right. Thank you.